Now, to talk about this more in detail, I'm joined by our health correspondent, Nicola Hill, who joins us from London. Good to see you, Nicola. So there is a shortfall of nurses. This is not the time to be lacking nurses, as we're seeing in the middle of a pandemic. We're seeing them putting their lives on the line for us without the equipment that they need. Why? Why has it come to this stage, Nicola?
Well, I think as the report from the World Health Organization is actually showing, there's been, for a long time, there's been a shortfall of nurses worldwide. This is something to do with a growing population. There doesn't seem to be enough investment in nurse education to match that population. Here in the UK, for example, there's nearly 44,000 nurse vacancies in England. And worldwide, the WHO says it needs nearly 6 million nurses to keep going. And as you just said, particularly at the moment, because what's so important with treating people who've got COVID-19, it's that one-to-one nursing, particularly in the intensive care units. Those are the places where you literally are having practically one patient for each, and each nurse is looking after one patient. So what the WHO is calling for is much more investment. It's wanting this $10 per capita in the future. It also wants more manageable migration of nurses. Now, one of the problems is that many from the lower and middle income countries, nurses who've trained there, then leave and they come to countries like the UK rather than staying in their own countries. They say 1 in 8 nurses who are in a different country didn't train there. They moved on for their own career prospects and to improve their own lifestyle.
And Nicola, what is the situation for midwives in these times of coronavirus? And goodness, how difficult it must be for any woman about to give birth in these trying times.
Yes, I was actually talking to a midwife here in London who's working on the front line. It was quite moving to listen to what's happening there, to be honest. She told me that she now has the correct PPE, the correct equipment that she needs so that she's not putting herself at risk from contracting the coronavirus from any pregnant women who come in, either for antenatal clinics or to give birth. Because, of course, as we all know with COVID-19, you can have the virus before symptoms show, and you can pass the virus on before you're showing symptoms. So this nurse, who I'm not going to identify because she's asked me to keep her anonymity, was telling me that until she got the right equipment, she wasn't sleeping the nights before her shift. She would cry before she would go into work because her husband is at high risk. And she knows that when she comes home, she would be potentially putting him at risk. She's taking all the precautions that you can imagine. For example, when she comes home, she gets undressed, she puts her clothes straight into the washing machine, she has a shower and everything like that. They sit on the sofa 2 meters apart when they're watching television. But she knows that when she goes to work, when she's on the front line, she's putting herself at risk. And then she told me that a friend of hers, who's a nurse not in London, still doesn't have the correct equipment, is having to reuse visors and eye goggles, which are in fact supposedly single-use pieces of equipment, but they're having to reuse them because they haven't got any. And so the woman I spoke to, the midwife I spoke to, said that she's actually been sending equipment to her. And as you said about the pregnant women who actually come in, they themselves are having to face midwives who are completely dressed in this equipment, which can be quite terrifying for a lady in that condition.
Absolutely horrifying, I can imagine. And we do hope that nurses everywhere in the world can finally get that personal protective equipment. Nicola, it's been a pleasure to speak to you. See you soon. Thank you.